Fortunately, in August, we were able to start admitting patients again for elective surgery here. But a great deal of planning and organisation went into that work and making sure that we were going to be a safe environment and accredited to admit people to what we call a green zone with special entry and exit points that would be completely clean site and where the risk of developing COVID whilst in hospital was going to be as low as possible. So for any patient who's considering having surgery here, they will obviously have the usual consultations, but we're doing those virtually. So we're trying not to bring people to the hospital unless absolutely necessary. So that will mean a virtual consultation. Where possible, any workup that might be needed for surgery, for instance, blood tests will be done at the GP surgery. The pre-assessment, which is the planning and checking that we do prior to surgery, is done remotely, and the patient fills a questionnaire in line. Then admitted to a unit that's being designated as a safe site to admit patients, and it has its own entry point. They can be admitted there and taken straight to theatre without contact with the rest of the hospital. And then at discharge, of course, they will go home and they're asked to strictly self-isolate for 2 weeks. But we will be following them up by phone initially and then with another video consultation if they'd like that to review their progress after surgery.
We have started getting ready for our patient to come back to the clinic as we usually have them come back, and I want to let our patient know that we have set up our clinic having all the policies that the government have in place for COVID to prevent any spread of disease or any of them catching up with COVID. We have a clean clinic and we have provided a sanitizing scrub agents just to clean the trolley after each patient. We have our hand sanitizer by the door for you to clean your hand, and we clean our table in between patients. And ensure that you have your mask on, we have our masks on while we are consulting with you.
If you are a patient that had to come in, I would reassure you that here at the hospital we are practicing strict social distancing. We are checking temperatures as you come in through the door. We're encouraging everyone to wear masks. And also we have made sure that appointments are scheduled widely so we can practice social distancing carefully. Patients with inflammatory bowel disease are large proportions on biologics. And what we done throughout our COVID-19 pandemic was we identified patients that were suitable to go to our clean mobile units, which is off-site. Patients were moved to this unit. Also, we had a small group that we kept here at the hospital. So for patients that come either to the mobile unit or to the hospital, get a telephone call the day before. We go through a COVID-19 checklist to make sure that they have no symptoms of COVID. Once that is clear, then they're asked to come in for their infusion, scheduled infusion. They come in with their masks. We encourage them to use hand sanitizers, and we also do a temperature check. After the infusion is finished and the patient is safe to leave the unit, then we will make sure that all areas and surfaces are cleaned appropriately. We also, patients who are on immunosuppressants and biologics do need to have their bloods checked regularly. One of the changes that we did make throughout COVID was that we extended our blood monitoring intervals, so patients didn't have to come back to us as often. However, we still have got our blood test room opened here at St Mark's Hospital, and patients will be called to arrange their time slot, and again would be encouraged to come to the hospital using the St Mark's entrance.
It's really important you keep in touch with your clinical team and you have conversations with us about any fears that you may have, and hopefully we can reassure you or at least put some parameters around what would be safe and appropriate care. We've looked after several hundred patients now through the COVID pandemic era, and they've all safely been through surgery. None of them have picked up the virus. So I really think it's a safe environment in which to have surgery, and I'd really encourage people to come forward and have their treatment.